Hello guys, welcome to Praveen YouTube channel. So today in this session I want to discuss about the most happening disease after diabetes. I wanted to talk about hypertension, one of the most seen disease nowadays, or the condition nowadays. So what is hypertension and what are the drugs and how to diagnose it, the stagings of it. I'll try to compress it as short as possible with the high yield aspects for various examinations, so you can have a clear picture of it and a basic idea. So hypertension, as you know, is high blood pressure. It's like the vessels are constricting here, so the heart is working more. So because the heart is working more and the cardiac output is more, the blood pressure is more, and which is called hypertension. So coming to the stages of hypertension, we know the normal value of systolic blood pressure and diastolic blood pressure is 120/80. Are 120, less than 120 or 120/80 are normal, and then 120 to 139 is pre-hypertensive, and 139 to 149 is stage 1, and 149 to 160 or more than 160 is stage 2 hypertension. Or here is a table, so you can just follow it. And then so what's the risk factors of hypertension? Can be obesity, can be diabetes, can be age, can be smoking, can be various other factors. This is for essential hypertension, whereas talking about secondary hypertension, there are reasons for it. It's not idiopathic, but secondary is another issue altogether, because secondary there are various systems that are malfunctioning. It could be an endocrine system failure, or it could be kidney disease that can result in secondary hypertension. But I want to discuss about the most happening essential hypertension in this video. So for the essential, as I said, these are the risk factors, and the mechanisms can be so as for the kidney is concerned, the sodium is retained more than normal in hypertension. And then there is vasoconstriction, as I mentioned, because angiotensin 2 is more in hypertensive patients, which makes vessels vasoconstrict. And because the vessel vasoconstrict, now the heart has to pump more blood, and for the heart to pump more blood, it need to work more, and the working of the heart can result in more cardiac output, which results in more pressure, and which indeed results to hypertension. So now what happens if hypertension occurs? Like, what are the complications? So there are various organs involved in hypertension. For the first one is concerned is brain. In brain, you see the arteries supplying the brain can get, you see, when the vasoconstriction is happening and the blood is coming with force. So this can result in what? This can result in tear of this vessel, right, and can lead to what? Hemorrhage. So this rupture can lead to hemorrhage, and can be intracranial hemorrhage or subarachnoid hemorrhage, and this can be a very serious complication. Whereas coming to eyes is retinopathy can occur, because it's the same. The vessels of retina can rupture, can result in low vision, or even more further blind loss. Even more further the vision loss of patient. And then there is other complication of heart. In heart, in coronary artery, the plaque formation can be intensified in case of hypertensive patient. So it can lead in ST elevated myocardial infarct, or normal myocardial infarct, or coronary artery diseases can be of more easier for a patient to happen in hypertensive condition. So these are one of the most serious complications of hypertension. So that's why hypertension should need to be taken care of. Whereas coming to diagnosing hypertension, as I mentioned earlier, the stages are given. You can use sphygmomanometer, or and electrical measuring machines are everywhere, so you can just measure it, but do not measure it when you are stressed or when you have the environment of somewhere and you are tense, because it can give a false reading. So be rested and then take a simple reading 1 to 2 times to confirm you are hypertensive. And then after confirming hypertension, so what are the necessary to take in to So after confirming hypertension, what can you do to prevent it or to decrease it? So there are various medications, but before we go to medications, there are something in our hands that are reversible. If you are stressed, try to not to be stressed, and sleep more. Sedentary lifestyle is what in most hypertensive patients is nowadays is seen. So try to rest more, think less, and then try to avoid sodium in diet, because it's because of sodium retention, right? So, and it's called DASH diet. It's now prescribed, which contains less sodium. If you're obese, try to reduce your own weight, and if you're diabetic, try to take your diabetic medications more frequently and on a timely basis. So, and if you're a smoker, try to quit smoking. And these are some of the avoidable or reversible factors in medication. So we're talking about the real treatment or medications that can be given for hypertension are, the first one that comes is ACE inhibitors, which is angiotensin converting enzyme inhibitors. Why is, as I said, angiotensin 2 is increased, and that's why the BP is increased. So if you can block that, we can decrease BP, right? So for the ACE inhibitors, we have medications ending with the term prils. So for the prils, we have captopril, risinopril, various other prils, and the side effects of these medications are given here, which is cough, angioedema, change of taste. Like these are captopril side effects. And there's other medication, ARB. ARBs are telmisartans. All the sartans come under this group of ARBs. Losartan, telmisartan. And telmisartan is one medication that is important because it can be given for a diabetic patient as well. So it can increase glucose uptake, whereas preventing the hypertension. So it's a very useful medication in ARBs is telmisartan. And then one of the medications that is useful in kidney absorption of sodium, so less absorption of sodium, the diuretics can be given, which are thiazide diuretics. One of the medication is hydrochlorothiazide, and then loop diuretics can also be given. Thus for about diuretics. And then we can give, as I said, this vasoconstriction. So to vasodilate, what medications do we need to give? Of course, this calcium channel blockers should also be given in these conditions, which are verapamil, nifedipine, and nicardipine. And there's hypertensive emergency and urgency as given here. And these are the medications for the conditions of emergency and urgency of hypertension. And yes, that's all the diuretics. And then there is and you know, there are also other medications like beta blockers. One of the most important for hypertension can be propranolol, esmolol, all those lol medicines. You know them as beta blockers, right? ARBs, ACE inhibitors, and there are calcium channel blockers. I mean, this would do for the hypertensive patient. So that's all a short summarized version of hypertension, guys. So don't be stressed, be calm, and many of the diseases can be cured. So take care till next time. Thank you.